thank you for watching this video about the Hruska Clinic Shoe List. The purpose of this video is to help educate you on the qualities of a good shoe and how that shoe can help out with your postural restoration trained program from your physical therapist, or to help healthcare providers to be able to find the right shoe to help integrate with their patients in the clinic. A little background with the Hruska Clinic Shoe List, that this shoe list originated in the Hruska Clinic and not in the Postural Restoration Institute, but the shoe list is based on the science of postural restoration. In the clinic, all of us clinicians here at the Hruska Clinic integrate postural restoration as our primary practice with our patients. We appreciate patterns, position, and human asymmetry, and how what your brain neurologically consists from the floor can impact patterns, position, and normal human asymmetry. Hence the Hruska Clinic Shoe List that was born in 2008. I was working with a patient who was coming in for knee pain, as she was a dental hygienist. She would come into the clinic in her scrubs, and she would come in tennis shoes in every visit. For PRI practitioners out there, her tests were negative at the neck, trunk, and pelvis. The Hruska abduction lift scores were at a 5 out of 5, but she was still experiencing knee pain only when running. And I could not figure out what I had missed or what exercise I was missing to help her to integrate to be able to run pain-free, because all of her testing had improved and all of her stability tests had improved. When she came in on one visit, I asked her if the shoes that she was running in were the same tennis shoes that she was coming in to see me in, and guess what? They weren't. She came back into the clinic 2 days later, and all of the PRI testing that was negative in the neck, trunk, and pelvis all became positive, all from a pair of shoes and what her brain sensed from the floor. At that point in time, I went and got one of my colleagues to have him observe and see how she would test neutral in the neck, trunk, and pelvis in the shoes she came in to see me with, and how all of those tests changed just walking up and down the hallway, and they all became positive, and how we discovered how integrative shoes could be with our postural restoration program and how they could really impact our rehabilitation process. And that's how the Hruska Clinic Shoe List has been born. We look at shoes as a team twice a year. We try to update and keep up with trends with footwear, and we try to update our list 2 to 3 times a year as changes with shoes occur. Let's appreciate how what you feel from the floor with your foot and ankle can impact your body position. As many of you know, your foot and ankle, your tibia or your shin bone, your femur, and your pelvis out comes your spine. Your body's all integrated. What your brain senses from the ground underneath your shoe or your foot can really impact your ability to walk or move forward in a positive way to allow your pelvis to alternate. What I'd like you guys to do is stand up for me. If you roll to the outside of your foot and your brain only senses the outside of your foot, so you're raising the inside of your foot out, and watch as you move side to side. You cannot move your hip or pelvis. Your brain only senses the outside of your foot. Your brain senses that you might roll your ankle and you might feel more tension or your low back. When we go to move forward, your feet should do something different, whether you're walking or running forward. Your feet should not be doing the same thing. When your feet go out to the side, what we just did, your pelvis is going to fall forward. That's going to affect your spine position. It's going to affect your thigh and your shin position. And it's going to affect your ability to move side to side. This is where we should get our power when we walk forward, or the ability to move forward. Conversely, if I want to move to my right side, if you stand back up again, and I want you to move your body over to the right, which would be your left as you look at me in the video. As we move to the right, I want you to keep your foot flat, and I want you to roll the inside of your foot. Look how much easier it is for you to move your pelvis and move your body over to your right leg, which is desirable for half of the walking cycle. I should be able to put weight on my right leg as I swing my left arm and my right arm and my left leg through the air. you've got to be able to roll the inside of your right foot, feel your entire right foot on the ground in order to be on your right leg in a good supportive stability position. When I do this with my feet and I roll the inside of my right foot, I'm allowing my left pelvis to come forward and my right pelvis to go back. This is desirable during a right stance, left swing phase of the gait cycle. Conversely, if I want to move over to the left side, I should be able to roll to the inside of my right foot, and I should be able to keep my entire left foot on the ground. That will enable my left dominant, or my left side of my pelvis, to move back and my right side to move forward. So then, if my brain can pick up different parts of my entire right foot, I can move back and forth that is desirable for walking or running. If your brain can sense your heel, arch, and toe and has a good supportive shoe, it's going to allow you to move through a walking cycle with correct biomechanics correctly, which is why it's important that shoes provide the ability for your feet to walk through that normal walking cycle. When our foot hits the ground, you should strike at your heel. You should roll on the outside of your foot, but then the middle part of your foot should be able to roll in, where you should sense your arch, where you can roll through to push off your back foot. When I'm walking or running forward, walking or running are the same mechanics. When I'm coming here, I'm getting to my middle part of my right foot as I'm pushing through. I'm at my left heel and pushing through to my toes and landing on my right foot. Your brain's ability to sense the floor and to feel all areas of your foot, heel, arch, and toe are going to enable you to move side to side and to be able to get power and push for walking or running through your pelvis. It affects your pelvis, affects your hip socket, which affects your femur or your thigh bone, which affects your shin bone or your tibia, which affects a lot of your ankle bones. You have 26 bones in your feet. And it's also going to affect your spine, because your spine comes off of your pelvis all the way up to your neck. So your brain's ability, again, to sense the floor really enables you to be able to move forward better and will help you to be able to integrate a rehabilitation process with your postural restoration trained physical therapist in a more effective manner. If you don't wear a good supportive shoe and your brain cannot sense the ground underneath your foot, you're not going to be able to move forward in the way that we want you to be able to alternate your pelvis back and forth like this is desirable for walking or running. The qualities that we look for in a good shoe is a heel counter, and we like a heel counter that does not collapse in. We like a heel counter that's balanced and symmetrical on the inside of the heel and the outside of the heel. And we like heel counters that are firm, that if you press down, you don't want there to be a lot of give on the back side of the heel. So again, we like a heel counter that doesn't collapse in. We like heels that are balanced and symmetrical on the inside and the outside of the heel. And we like heels that don't give on the outside of the heel. And a lot of shoe companies sometimes like to cushion the outside of the heel, because when we land on the outside of our foot, they're trying to cushion it when we get to that heel strike part of walking. But if you give too much give on the outside of the heel, you're going to land on the outside of your foot, and it's going to make it hard for your foot to roll in and push off your big toe. The heel counter and the ability for it not to collapse in, you guys, is a really big deal. If you look at the Ultra Boost or the On Cloud are two examples that are really popular right now. And guess what? This is an On Cloud shoe. The heel counter completely collapses in. It's symmetrical back here. It follows that. There's not a lot of give. There's some give here. Look how wobbly this heel is with the On Cloud. So that's going to make me have a wobbly heel. So the heel counter collapses in. And this back here is really wobbly if you look at this heel counter. Well, you need to have a good stable heel counter, especially if you ever rolled an ankle, plantar fasciitis, or heel bursitis. But it's really important to have a good stable heel counter, because when you go to walk, you've got to be able to roll your arch up, which is called supination. And then you've got to be able to repronate or roll in your foot when you land on your foot in order to push forward onto your opposite leg. If you have a heel that collapses in like that, now your heel and your midfoot are going to be wobbly. And you're not going to be able to work the middle part of your foot to roll out or roll in with proper biomechanics. The heel needs to be firm in order for the middle part of the foot to roll out and roll in, which is desirable as you move forward. Another quality that we look for in a shoe, aside from the heel counter, is we also like we like to have the front part of the shoe that bends. This is the normal bend of your foot. If you look at my foot from the side, when I go to take a step forward, see how my toes bend? And I bend across the ball of my foot. If you have, some shoes will completely collapse in the middle. And those shoes are not going to be supportive enough. And you're going to be at a higher risk for a stress fracture in your foot, plantar fasciitis, or heel bursitis. That is not the normal bend of your foot. The normal bend of your foot is up here. Conversely, if we go back to our on-cloud shoe, or another example I'm going to show you is Hoka shoes. And those shoes, look, I can't even bend this toe box. So look how stiff this is. If you have a toe box that is that stiff, you guys, when your patients or when you go to walk or run and you roll through here and you're this stiff at the toe box, you're going to have to overwork your hip flexors and back extensors in order to push forward, because this isn't going to bend to allow you to get to push off when you go to walk forward. So your foot's going to come here, stiff, stiff, stiff. Guess what? You're going to have to pick your foot up again with your hip flexor or hyperextend your back, and now you're going to become a puller when you walk versus a pusher. And it could create neck tension, it could create low back tension, overworked calves. So you don't want to have shoes when you have normal mobility at a big toe joint. So if you look down at my toe, I'm going to get down here on the floor. This is normal mobility. When we put on our handout, limited first terrain mobility, we want you to have the ability to pull your toe back towards your shin. This is normal range of motion. Some patients can't pull their big toe up. Maybe this joint has arthritis, or it's been fused or bunion surgery, and they've lost some of the mobility of their big toe, and this is all the further they can pull their toe up. Then those are the individuals that need to have a toe box that's really stiff at the toe box. Those are the people that fall underneath that category. But putting someone like myself that has good range of motion at my big toe joint and a shoe that has a really limited toe box is not going to work well with their rehabilitation program, and might actually exacerbate pain throughout their body by not having the right shoe for them. The last thing that I want to go through with you is, even though a shoe is on our shoe list, I want to let you know it's going to fit all the good criteria that we like in a shoe. But now, what is the right shoe for you if you're watching this video? We have shoes that fit. You can look at different arches of your feet. That is kind of more of a minimalistic way to look at shoes. So we want you to take it a step further. If you try on a shoe from our shoe list, we want you to walk around. Can you feel your whole foot on the ground? Can you sense your heel when you walk? Can you sense your arch? Can you sense your big toe? I don't want you to feel like you have to push into the shoe. You should be able to sense it. And if you walk around, you know what? I can feel my left heel like I can my right heel. I can feel my right arch like I can my left arch when I walk. I can feel my right big toe like my left big toe. That's great. Then what I want you to do is I want you to stand still, take a step forward. You're going to stand on both legs, but let's start with your right leg. Take a step forward with your left leg. Reach forward with your right arm, back with your right. Pick your right foot up off the ground. Can you feel your entire right foot on the ground? Heel, arch, and big toe. If you can, thumbs up, great. that shoe is supportive enough for you, your body type, and your foot. Then get on your left leg. Take a step forward with your right foot. Reach forward with your left arm and back with your right. Pick up your right foot. Can you sense heel, arch, and big toe? If you can, that shoe, your brain can sense all parts of your foot in order for you to stay grounded to the floor, and your foot can work with that shoe. The last thing is I would encourage you to work with a postural restoration trained physical therapist. I like to watch my patients walk in their shoes, and I like to do PRI objective testing to make sure that they are neutral with their neck, trunk, and pelvis, to make sure that that shoe is good for them. The shoe should feel comfortable right away. Make sure you lace up the shoe from the bottom up when you put it on. Your shoe should be tied tight enough that you have to untie your shoe to slip your foot out, and you have to, you don't leave your shoes tied. So you got to untie your shoe to put it in and untie your shoe to take it out. Otherwise, you're going to break down the heel counter if you're leaving shoes tied, or if they're not tied tight enough, your heel's going to slip, which could also affect what your brain senses from the ground. We want that foot to work with the shoe. So we also want shoes that have supportive on the upper part of the bast of the shoe. The supportive that the foot isn't flying around, and the foot and the shoe are working together to sense the ground underneath that shoe. So I hope that this video was instructive enough for you. Again, we will put up videos throughout the year of what shoes are coming on and off our list as shoe companies change them. But I hope this helps you to be able to find a good shoe for you, what we look for in a shoe, and we really appreciate your time and attention and the support of the Hruska Clinic Shoe List here in Lincoln, Nebraska. Have a great day.